Well, the NHS Confederation represents hospitals, ambulance trusts and primary care networks, among other services, in England, Northern Ireland and Wales. Chief Executive is Danny Mortimer, who joins us live on the programme this morning. Thank you very much for being with us. Give us an idea. What are the main areas of pressure at the moment for you?
Good morning, Dan. Thank you for having me. There are four things happening right now for NHS teams across the UK. I think the first is, as you've touched on, responding to the virus, and obviously infections and admissions to hospital in particular haven't gone away. The second is dealing with non-COVID patients. It's really important to us to maintain our services beyond COVID. The third is the mounting pressure of winter. And the fourth is mobilising our staff for a mass vaccination programme over this next period. And across all those four areas, a workforce that, to be frank, is pretty tired and was in shorter supply than we would have liked before the pandemic, is having to make trade-offs and choices between those four areas. OK, and in terms of, we mentioned there as we were running through, sort of taking us back to April at the height of the pandemic and where we are now. How do you feel that the latest lockdown measures have affected the pressure that you currently feel? So I think it's probably too early to fully tell. I think we always believed it would take a couple of weeks to feel the benefit. We're starting to see some tentative improvements in the areas that were worst affected, particularly in the northwest. But as we look forward to whatever the Prime Minister announces today, what leaders in the NHS want is clarity in terms of what's announced. We want, obviously, the public to follow the guidance that's put in place. And we want a test and trace system that works, because that final step is really key to suppressing and containing the virus whilst a vaccination programme builds and takes effect.
We'll be speaking to the Health Secretary, Matt Hancock, on this programme. And the other thing that might be announced later this week is sort of Christmas plans. I wonder how you feel about that, and how those in the NHS feel about that potentially relaxing of those regulations and restrictions around the Christmas period, where we could have a number of households meeting up. How do you sort of process that, and what that might mean for January and February for the health service?
I think right now, the health service, whether it's colleagues who are working in hospitals, colleagues who are working in GP practices or elsewhere, are really nervous about that combination of factors I touched on, particularly winter and responding to the virus. Whatever's announced today, whatever's announced about the Christmas period, needs to be still pretty strict. And it needs to be underpinned by, as I said, a test and trace system that works. Without those kind of things, I think there'll still be nervousness in the NHS, to be frank. OK, so if it's hard to know exactly what will be said, but if there is to be a relaxation of the amount of people who can meet in a household, for example, and the number of households who can meet, you think that can only happen if there's that rigorous test and trace system which sort of filters into that and makes sure that doesn't cause the issues that could then cause problems for the NHS? Yes, indeed. And clearly that isn't just about Christmas. That's about this next few months. If there is to be a new tiering system, albeit a stricter one than we had before this latest lockdown, that test and trace system, that ability to identify people who've been into contact with someone who's tested positive to the virus and to isolate them for a proper period of time is really key. People in the NHS, of course, understand the importance of Christmas. We all have families too. We all want to try and get together with them. But we also understand the impact that the virus has had on the population and on our services. Funding is also a really crucial issue at any time for the NHS, but particularly at the moment. I'm sure you've seen the BMA calling for £10 billion of additional funding. The Chancellor has announced more money, an extra £1 billion for catching up as well. In terms of funding, I know we can talk about billions and millions and you get lost in the money a little bit. What would be your sort of message this morning for the amount of money that is needed to help and try and catch up from where we have been these last few months? Simply what the Chancellor's announced is not enough. The impact of the virus in terms of backlogs of treatment, in terms of demand for new care, people suffering from long COVID, growing mental health problems, the long-standing issues we had before the pandemic, particularly in terms of workforce shortages and our capital for our working environments, not to mention social care and public health. £3 billion just is not enough, Dan, to tackle the issues that the NHS and our colleagues in social care are going to face in the next couple of years.
And we've spoken over the last few minutes about sort of comparing where we are now with back what was happening in April. I wondered, from those staff that you've spoken to, or those those concerns that you have for sort of mental well-being of staff right across the NHS and across the medical profession, where do you think things are now compared to how it was back at the height of the pandemic?
I think the base note in pretty much everyone I speak to is how tired our teams are. They've been working at this level of intensity now, both in terms of the virus, but also in terms of trying to maintain and restore non-COVID patients since the beginning of March. So there is this feeling of tiredness. And to come back to the spending review, there is an opportunity for the government to give those people hope that the long-term problems they've been experiencing, the vacancies and gaps in their teams and rotas, are going to be addressed, that there is a plan. There is an investment plan in particular that will enable us to educate more people to join our clinical teams right across the UK.
OK, Danny Mortimer, really good to talk to you this morning. Thank you very much for being with us. That's Danny, who is the NHS Confederation